Chairman Burke, Vice Chair Huffman, Ranking Member Antonio, and members of the Health, Human Services, and Medicaid Committee. Thank you for allowing me to testify in this committee again today. My name is Parvaneh Nouri, and I am now a fourth-year medical student at a public medical school in Ohio, where I also recently received my Master's of Public Health. I also serve on the board of directors for the international nonprofit Medical Students for Choice. I am a citizen of this state and a prospective resident physician of this state with interviews starting later this year. As a disclaimer, please note that my testimony here today is reflective of my own convictions and not necessarily those of my institution. I am here today to provide testimony in opposition to Senate Bill 23 as a prospective resident physician of this state. From the medical perspective, I'd like to highlight how this bill is incredibly harmful, and I preface by saying it goes far beyond the ways in which it turns my colleagues, physicians skilled and dedicated to providing reproductive care to Ohioans every day, into criminals. The earliest time a fetal heartbeat may be detected is about 6 weeks, give or take a few days. Interestingly, this coincides with the same time many patients first discover they are even pregnant at all. I can tell you from my own clinical experience, serving in community hospitals, clinics, and serving our nation's bravest at the Air Force Base, that I did not encounter a single person who was able to confirm a positive pregnancy test with an ultrasound before 6 weeks. By prohibiting abortions after this time, the number of Ohioans that will be forced to leave and seek abortion care in another state will undoubtedly increase. Further, from the many Ohioans who are further marginalized by poverty, discrimination, or unsafe domestic situations, the means of securing transportation, childcare for their already existing children, or merely the safety to leave for any period of time at all is just not possible. This bill would make an already extremely difficult situation impossible for many. What I find most troubling about this bill, how this bill is meticulously worded to facilitate harm doing, is how it contains no exceptions for the cases of rape or incest. Unimaginable traumas I certainly hope no one in this room has ever encountered, nor will ever encounter in their lifetime. Having had patient survivors, children as young as 7 years old, I can assure you that the lack of due diligence to include such exceptions in an already problematic bill is horrifying. I ask you to think again about who this bill, as it stands, protects. I recently read the response from our lawmakers regarding questions on the lack of such exceptions, and their response was, quote, "We should not punish the child for the sins of their father," end quote. I ask you now to rethink this statement with the question, which child? This bill does not include room for such cases. Every day, we healthcare professionals of this state battle an increasing maternal mortality rate coupled with an already alarmingly high infant mortality rate. We are tired of watching people die when put into situations that could have been prevented had we been enabled and supported by our government to provide our patients and our citizens with safe, high-quality care. If instituted, this bill will increase the number of Ohioans dying every single year. As for what this means for medical students, residents, and already practicing physicians, we make decisions on where we train, where we practice, and who we serve, based on the restrictions placed on our ability to care for patients. For those of us who want to work together with our government to provide patients with comprehensive reproductive care, this bill quite simply means leaving this state. At present, Ohio is categorized as an extremely hostile state in regards to comprehensive reproductive care. This bill will undoubtedly cost Ohio countless of qualified and compassionate care providers. And further, while this bill would criminalize an abortion provider, only a small subset of practicing physicians, it would directly attack the binding fellowship of all physicians. I've said it before in this very room that our healthcare system, I truly believe our healthcare system and government involvement have the great potential of operating as a mutual partnership, one that facilitates positive patient outcomes and preserves our global leadership in the highest standard of care. As a physician, I want to serve my patients under that standard of care, regardless of which state I practice in. On behalf of the well-being of all Ohioans, I urge you to strongly consider my testimony and vote no on this bill. I urge you to consider the health of our citizens and of Ohio families that rely on you to protect them.